Welcome to Med-Surg Tutor. In this video, I'm going to go over how to write a nursing diagnosis. Before we jump into the steps, let's look at what a nursing diagnosis is. So what is a nursing diagnosis? It's a way that nurses describe a patient's health problem. It helps the nurse understand what is going on with the patient, and it helps the nurse figure out how to help the patient. In the highlighted section, I actually have an example of a nursing diagnosis before we go into the steps. So our example is acute pain related to surgical incision as evidenced by patient rating pain 7 out of 10, grimacing, and guarding abdomen. So the related to and as evidenced by is going to be very important, which is why I highlighted in red. So just keep those in mind as we go through the steps. There's also an official list of nursing diagnoses called the NANDA 1 list, and it helps nurses choose the right diagnosis, just to mention here as a reference. So why do I need to know how to write one? As a nursing student, and as nurses, once we know the issue, we can take action by planning and coming up with interventions. It tells us what the health problem is, it tells us why the health problem is happening, and it helps the nurses plan the best care for the patient. Think of the nursing diagnosis as a language. Just another tip to get in the mindset of thinking like a nurse and using those critical thinking skills. So step one is to find out what the problem is. What's wrong with the patient? Here we're going to look for signs and symptoms. In the corner we have our patient David, and we're going to use our nursing assessment skills to gather the information of what is going on with the patient. And remember, with our assessments, we're doing our head to toes. We're looking for objective and subjective information. So the example here for the finding out what the problem is the patient has low oxygen saturation, which is measured by pulse oximeter. So the problem here is impaired gas exchange. This means that oxygen is not getting into the bloodstream properly. So after you complete your assessment, you'll figure out what the problem is. And the problem is impaired gas exchange. This patient is not getting oxygen. David is not getting oxygen. So boom, first step, we have our problem. Step two, we're going to find out why this problem is happening. What is causing David to not have enough oxygen? Is it an injury, a disease, or something else? So here, I gave an example. The patient has a lung infection, pneumonia, that's affecting their ability to take in oxygen properly. So the cause is related to a lung infection. So here we gathered information to find out what the problem is. And then in step two, what is causing this problem? So here we found out that David has a lung infection, which is impacting his oxygen saturation. Going back to the first step. Now let's go to the third step. Let's look for symptoms. Okay, so we assessed them, found out that he's not getting enough oxygen. And then we found out he's not getting enough oxygen because of pneumonia. He has a lung infection. Okay, so what symptoms is going to prove to us that this is the case? So the example here is the patient is short of breath, has a cough, and their oxygen saturation is low at 90%. So usually here, we want to know the vitals, what is normal for the patient. So knowledge jumps here, and we know that 90 for oxygen saturation is on the lower end. So symptoms as evidenced by is shortness of breath, cough, oxygen saturation is 90%, which is usually supposed to be 95% to 100%. So going back, boom, we know the problem, low oxygen saturation. Why? Lung infection. What are the symptoms? He's short of breath, he has a cough, and low oxygen saturation of 90%. So remember those highlighted points I gave you as evidenced by and related to? That I want you to keep in mind the tip I gave you at the beginning of the video. So the tip is think of nursing diagnosis like a language. So the related to and as evidenced by is going to kind of put our sentence together for the nursing diagnosis in a way of a language. Alrighty, That's all done. Now you can help your patient because you know what is going on. Next, you will implement nursing interventions like positioning, medication, oxygen therapy, and then you would reassess, monitor, and evaluate outcomes. So the AdPi video I dropped in on my channel earlier is actually going to be helpful for writing a nursing diagnosis. A patient can have more than one nursing diagnosis, and it's up to the nurse to use critical thinking skills to know which one takes priority. So our patient David here, say we put together those interventions, we elevate the bed, we give him medications, everything he needs, we give him supplemental oxygen. Now the problem is solved because we use the nursing diagnosis and critical thinking skills to know where to begin to solve the problem to help our patient. Alrighty guys, in the next video I'll be talking about vital signs, so stay tuned.